Good evening. This is a quasi-virtual meeting of the North Andover Board of Health, Thursday, March 25th, a little after 7 p.m. I'm Joe McCarthy, the board chairman, and there is a quorum, but a roll call of board members is required. So to my left is Michelle Davis. She's the board clerk. And to my right is Dr. Patrick Scanlon. He's a town physician. Also joining us right now is Brian LaGrasse. He's the director of the Department of Health. Steve Casey, inspector, and Tony Wolfenden. She's the clerk. So the meeting is called to order. There are two things that before we open it.
You forgot about Max.
Max is here.
Oh, I'm sorry. Max is here too. Max Tilson.
Hey, Joe, sorry.
He's here.
Yeah.
He's here remotely right now. My mistake. So the meeting is called to order, and there are 2 points I want to cover before we actually open up the meeting. The first, obviously, is the Pledge of Allegiance, followed by the governor's statement, which must be read at all virtual meetings. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and justice for all. The governor's statement on virtual meetings. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information in the general guidelines for remote participation by members of the public and/or parties with the right and/or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their televisions by turning to Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate in public hearings, please email your question, comment prior to or during the meeting to blagrasse@northandoverma.gov. That is BLAGRASSE @northandoverma.gov. The question comment will be read during the proceedings and responded to accordingly. I am going to be struggling with this mess. I'll tell you right now. I'll do the best I can. A couple things I want to also further elaborate before we go to old and new business. The structure of the meeting. As you can see, we are at least 6 feet apart. Everyone here is wearing a mask. We are required to do that because not everyone in this room has received their second or their final vaccine as of several weeks ago. Once everyone is fully vaccinated as of several weeks ago, then we will not have to wear a mask. But at this particular time, we do. Nevertheless, this is exciting because this is the first live meeting that we've had in about a year. And as you can see, and as mentioned earlier in the governor's statement, there was no one sitting around just watching us right now, no one from the town. Also, just want to comment a little bit about what does the Board of Health do? And first, all board members are residents and volunteers appointed by the Select Board, and we're in the Select Board's office right now, our conference room, I should say, with recommendations from the town manager. The Commonwealth of Massachusetts has granted authority to local Board of Healths to develop, implement, and enforce health policies, oversee inspections to maintain minimum standards of sanitation in housing and food services, and assure that the basic health needs of the community are being met. And this is a few examples, then I'll turn it over to Brian as far as what we have done, what we are doing. One is enforcement of state coronavirus regulations, vector control, focus on mosquitoes, and also on ticks too, to an extent. Prepare and update regulations such as food storage, tobacco, outdoor wood burning boilers, body art, septic systems, trash haulers, et cetera, et cetera, et cetera. So if you'd like to know more, just go to our town website. At that, approval of the meeting minutes from February the 25th, 2021. Michelle?
Yep. I have reviewed and approved the February 25th, 2021 minutes with no adjusted changes from my perspective.
Okay. Is there a second?
Is that a motion?
I'll make a motion.
Okay, make a motion for a second.
Second.
Okay, all those in favor say aye.
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 Good, okay. Old business, COVID-19 fines, Adam McClellan, 115 Wincest Farm Road. Brian?
Just wanted to give you guys an update. At the last last meeting, we had a public hearing to go over an appeal for his fines. You did reduce them down to $1,600 in total. We are still waiting to collect those funds. I believe his deadline may be either tomorrow or Monday, depending on when he actually got the original letter. So, just want to give you a heads up on that he hasn't paid yet.
What happens after the due date?
That is, we can do a couple different things. You can bring the fine back up to the original amount. We can file in court. We can have another public hearing, have them back. There are different options, but I just wanted to at least bring that to your attention, see how you guys wanted to move forward with this. If he doesn't pay, we did reach out to him earlier this afternoon, I believe, sent him an email, just said, hey, FYI, there's a letter coming, I'm gonna ask you to pay. Just your little friendly
Find
reminder.
it to be a little bit troubling that he hasn't paid. The fine was for 3 separate violations. Party, I believe, was New Year's Eve. By his own acknowledgement, there were up to 125 people there. And the state regulation, not guideline, regulation is no more than 10 inside. Yes, he does own a big house, but there was a lot more than 10 people there. So we left that fine in place. It was $1,300. It could have been $1,500.
1,600.
Yeah, it could have been 15. 1,300, 1,000 state, 300 from the town. Then we moved to another motion. Again, we did break it into threes. The second motion was social distance. We did not have sufficient information because none of us could go inside his home. And yes, there were 125 people there at one time or another during the evening, but probably not all at the same time because they were coming and going. So we waived that fine. And the last one was mask. We know for a fact that certainly some people in and around his property were not wearing masks. And we did reduce the fine. We reduced the fine from $1,300 to $300. So he got off with a $1,600 fine, and it could have been $3,000 $900. So we really gave him the benefit of a doubt. You know, he said things as far as the signs and so forth in his home at that time, social distance and so forth. Well, I don't know about that. I really don't. But we went there. We went inside. So we gave him the benefit of doubt. And here it is, a month later, and we haven't received a penny. So it's something is, I don't know, perhaps he doesn't take this serious. I don't know.
Is the letter that's going to him like a certified letter that, yes? I mean, I would, maybe for starters, have him, he doesn't pay, have him come back to the board next month. And then if he does not show up to the board next month, then we will take the matters into our own hands again.
Okay.
We'll go back
Do that.
to perhaps the $3,900.
His deadline hasn't passed yet, so
Yeah,
just,
yeah, but that's what I would recommend if he hasn't paid.
Is that in the form of a motion?
it
Doesn't matter?
Yeah,
Okay.
just a discussion.
Okay.
We can carry out the policy.
Michelle, any comment on that at all?
No, I agree with that, that's fine.
Okay,
Okay.
fair enough.
Okay. New business, TBI Industries, here on Holt Ave, North Andover.
TBI had another fire. There was some work being done on the reconstruction of the new building, that there was a subcontractor in there doing what they call hot work, so it was either welding or grinding metal that causes sparks. One of the bays that had some trash in there, it's construction debris, so it's not trash, but construction debris that hadn't been separated yet, I believe did catch on fire. And the fire department had to go out there, the bay was on fire, they did put it out, but it turns out he didn't have the correct permits through the fire department, didn't have inspections through the building department, and he did not have approvals by the Board of Health to be operating. So the temporary operation that you guys granted them last year ran out in November. So they've been working since November without board approval for temporary operations. They sent a letter back in 2019. We had a hearing. There was some limitations on what they could do. There were only a few bays that they could use. There was a limit on the number of tons they could take per day, which was, I think, 250 tons per day. And then obviously they would get their designs for their new structure and go through the building department and DEP and get all of those approved. They didn't do that over the course of the year, and they never came back for additional time, and they just kept operating. So we don't know if they're operating under the existing limitations or if they expanded beyond that. We don't know. But just wanted to bring that to your attention as well.
So they had been operating at less than 50% capacity. And how bad was the fire?
It was contained to one bay, and they did put it out. So it wasn't nearly as bad as the last one that took out the entire building.
Do they still have the fire truck there?
Yes.
They do.
I don't know if it's in use.
No.
If they could use it, but they do have their own fire truck, yes. But, so the fire department had to go out there, and it's unfortunate. I know we bent over backwards to let them operate under a limited capacity for 1 year, and they just didn't quite do things properly. They did have another fire, and now we're back to basically ceasing all operations over there again until they come back and apply for, or request temporary operations through the board. So DEP has been out there, fire department, obviously, building department, and fire department, building department, DEP, and us. So
I've been there a number of times over the years, and as you said, they handle primarily C&D material. They also handle recyclables. You can take your recyclables there, which you may or may not have to pay to dispose, depending upon what you're bringing to them. And the operation, before they had the big fire, not this last one, but the prior one, very, very well operated and maintained facility. From my perspective, because I am in this business to an extent,
Yes.
they've done a very, very good job. And it's a shame that they have the fire now, which is only going to further delay the full startup of the facility.
Correct.
Because the price of commodities is really going up right now and probably will continue to go up as the economy recovers. Whereas, wasn't that long ago, there was no market for recyclables at all. As a matter of fact, a lot of people, they throw away, or they have their recyclables separately disposed from their home, and it ends up in a landfill or the waste energy facility anyway. There just hasn't been the market there. So the market is getting better, and again, this is a tough time for them to be down, and I wish them nothing but the best.
Okay.
But nothing's going to happen to them as far as operation. Correct me if I'm mistaken, Brian.
Correct.
Until they submit these permits.
Yeah, they have to apply for temporary operations. So the town collectively, fire, building, health, and town council is sending them a letter that's being drafted as we speak to get out to TBI to say what they have to do to move forward.
They
All
don't
right.
have to- They don't have to come in front of the board, right? They just have to reapply and then.
They
be
can submit a
granted.
letter. Chairman can grant me authority to approve them temporary operations, but I will have them come to the next board meeting regardless
Okay,
of when that happens. But they have to get all of their stuff with building and fire done. Life safety issues are obviously extremely important. We need to get that done first and foremost.
Any idea where recyclables are going right now that that facility is out of commission?
I do not know. So I believe when they pick it up, they do take it to another facility, just because in terms of volume, when they do the town's recycling. They take it to Saugus, I believe.
Okay.
that was the one on 114,
I believe
and,
so.
I mean, Route 1.
Yeah,
There's a wheel right over there.
yeah. Okay.
Communications, announcements, and discussions. COVID-19 update. Brian, once
All right.
again, all yours.
Just want to check in with Max, see if he has anything to say on the last item. He's being
Okay.
quiet over there at home.
No, I'm fine. I'm just listening, guys. I'm sorry I'm not there.
No problem, no problem. All right, so COVID-19 update. It's not as lengthy as the previous few meetings, but I do have some things to update you guys on. In general, we're starting to see an upward trend again. Massachusetts, the numbers today were 1,865 new cases out of 106,000 tests. So testing is still going strong. I wasn't sure if it was going to start to fade away a little bit now that more people are getting vaccinated. Less people will be getting tested, but they're still doing over 100,000 tests a day. The testing percent is up to 2.2% positivity rate, which is higher than it's been in a couple weeks. It was down below 1 for a little bit, which was fantastic. That is starting to creep back up a little bit. North Andover as a town, we're starting to see an upward trend locally as well. We had 78 cases yesterday. We have 84 today. We're getting between like 3 and 15 cases per day, depending on the day. Like Sundays are usually really slow. We get like 3 cases. But we had, like I said, between 3 and 15 cases a day. We had 78 yesterday, we're up to 84 today, so we had a few today. Our percentage, our positivity testing rate is 1.03%, so we're still around 1, haven't gone up as much as the state average, but it's still starting to creep up. We're down below 1 at like 0.85 last week. So, starting to creep back up.
Merrimack Valley?
Excuse me?
Merrimack College, excuse me.
I wouldn't blame anything on Merrimack right now. Their numbers are holding pretty low. I think we have 5 total cases at Merrimack and 79 cases in town. So they're not driving our numbers up by themselves. It's a whole host of different issues. I think more people are out and about. I think people are being that maybe mixed with complacency and people not being as adamant about mask wearing, gatherings, things like that is a contributing factor. I think the weather's getting nice out, more kids are playing sports, and it's not the sports that we're seeing transmission in, but it's the groups that play the sports. So a group of friends that all play in the same basketball team but go out and hang out after school, and they carpool, and they go to, well, not Chuck E. Cheese, but they go to eat, right? They go and they do stuff together, And that's sleepovers and slumber parties. You have the indoor transmission is still probably our number one contributing factor to the increase in transmission rates. So regionally and locally, we've seen sports clusters, like I said, mostly related to friends versus sport actual transmission. A little concern about Easter coming up. It's another indoor dining holiday where people get together, family members sit and eat around a table for a few hours and kind of do the family gathering thing. So if anybody's listening at home and they're thinking about what to do for Easter, just make sure you know who you're going to be having dinner with. If there's highly susceptible populations you're going to be with, make sure they're vaccinated, or make sure you wear masks, socially distant, things like that. We have actually written something to get out next week ahead of the Easter holiday, just to remind people about some of these things.
It's also Passover this weekend, so same thing for
Yeah,
Passover.
that's true. So, so a lot of household spread is what we're seeing. When we go through our Maven, we go through our lists and our tracking, you see it go through an entire household. Like 5 people in the same household, all within the day of each other. Because one person gets it, brings it home, then it goes throughout the entire house, and you see the same address and the same name 5 lines in a row. You're like, okay, all right. So I guess they're staying home for the next 10 days.
When I saw this uptick in coronavirus cases here, I was surprised, because in Massachusetts, there have been over 3 million vaccinations, and over 1 million of the 3 million people that have been fully vaccinated, either with the 1 shot from Johnson & Johnson or the 2 shot from Pfizer and Moderna. Plus the fact that over 500,000 people in Massachusetts have had the virus. So it says to me that we just can't be that far away.
We're getting there.
From hurting.
We're definitely getting there. It's a slow process, though, because there's 7 million people in Massachusetts, and getting 2 shots into every arm takes some time. But our numbers are looking really good, and I can go through some of our clinic stuff now. We just completed our last 2 65 and over clinics last weekend. We did one at the youth center and one at Merrimack College, and that was sponsored. One of the youth center was sponsored by Greater Lawrence Family Health Center, and we did about 500 residents last Saturday and Sunday, and that was the second dose clinics. So that goes pretty well. So we also completed 300 seniors at one of the long-term care facilities in town. They got their second doses. That's been taken care of, and then. One thing that I think is worth noting, and this is actually last week's, the site was having trouble tonight, so they usually update it at 5 o'clock on Thursdays, and having some technical difficulties, so I couldn't get the new numbers, but as of last Thursday, from the age group from 75 plus, at least 1 dose, 89% of the residents in town in that age group have been vaccinated at least once. 65 to 74, we're at 73%, and that was a week ago, so these numbers have gone up. We have done more, especially with the clinic Saturday and Sunday. So hopefully those numbers will go up and we'll get the most vulnerable populations done at 100%. So that's a really good thing, a really good milestone, I think, to get to.
Do you guys get notified of, like, I got vaccinated at Lawrence General. Does that get fed back to you?
No.
Okay.
No, not individually, but it goes onto the MIIS, and the state tracks the populations and the ages, and they put it on their vaccine updates.
So I would come up as a North Andover resident that has been vaccinated.
Yep. So in your age group, you'd be checked off, and you're probably in here. Granted, the age
20 to
groups that
25
we're in,
age group.
20, 25? Yeah, all right. So for instance, 30 to 49, our population is just over 7,000 residents. Percentage of the town is 23% at that age group. Individuals with at least 1 dose is 1,800 in that age group, which is 26%. And 22% of individuals in town that have gotten vaccinated in that age group. So obviously the percentage of 22 is less than 89,
Yeah.
but it's only people that are either medical professionals or work in the industries where they had access to and were eligible to get the vaccine. So teachers, we just did teacher clinics as well. Teachers received their first dose that they went through Greater Lawrence Family Health Center in town here, and that was on April 10th. And their second doses, sorry, that was March 13th. Their second dose is scheduled for April 10th, and they'll be fully vaccinated by the time schools reopen for the middle and for the middle school and high school. So I think in those.
All teachers that are?
Anybody who wanted it, were
Wow.
able to get them. So, DPW is scheduled, actually, I think they started today, also through Greater Lawrence Family Health Center. So I definitely want to thank that organization. They've really stepped up and helped us out with getting us clinics for the eligible populations.
Is there a motion?
There we go. All right. I guess we're not moving around enough, huh? And Christina Minicucci has been instrumental in partnering up with us and getting us into these clinics for our eligible populations. So that has been truly fantastic. I think local public health in general has taken a hit with us not being able to get the vaccine, because even the ones that have been able to do it still through some regional collaborations that are in, they call them some dead spots for vaccine, have done a really good job getting the vaccine out there. I know they're looking to do, they have the one up in Amesbury that just opened up, the Amesbury High School for the Northeast. They're also trying to get one at Salem State as well through local boards of health, and to get hopefully more vaccine to people is make it as convenient and easy as possible. I think that's the key, and that's what we're trying to explain to the state, that we make it convenient, local, and easy. So if you give it to us, we'll be able to do just as good of a job as you at the mass vaccination sites. I think people are just leery of driving someplace they've never been before, and they think they're gonna be with thousands of people, and it's a little intimidating for some populations. So
There are different ways of tracking the data. I know the Boston Globe goes into some detail every day, saying that, look, there's about 4.1 million adults in Massachusetts that should be or could be eligible for vaccination. And if you take, other numbers are very, very interesting. Like if you take a look at the age of hospitalized patients with the virus, it continues to go down. If you take a look at the age that people die with the virus, it continues to go down. So this is further an indication. You were spot on when you're saying, what was it, 89% of all adults 75 years of age or older
in town here, and it's
have been
probably more than that
vaccinated.
now, yeah.
So these numbers, hospitalizations, I think it's less than 600 right now.
Yep.
Deaths, the age is going down.
I think the hospital's up to 628, so that's actually
628.
crept up a little bit.
Yeah, up a
But
little
it's
bit,
better than
yeah.
4,000
I think it was like 580 a
last
couple
spring.
days ago.
Yeah.
Yeah.
Yeah. So right now, residents that are 60 and over are eligible to get vaccinated. And then on April 5th, that goes down to people 55 and over. And then on April 19th, anybody who is 16 and over can get vaccinated. And the state's doing the pre-registration. So you can pre-register ahead of time, get your name and your information into the state system. Then when you're eligible, they'll reach out to you and say when they have an opening and where. And
So-
obviously they do it geographically to make it convenient and easier.
So
for
if
you.
you're like 16, 17 years old, you can pre-register right now?
You can
And the
pre-register.
state will let you know
Yep.
when you're eligible.
And then when you're eligible and they
To
have
be
a-
vaccinated, and indeed, where you
Yes.
can be vaccinated
Yep,
in the
so
exact
you can
time.
pre-register online on the website, or you can call 211, which if somebody doesn't have internet or they're not computer savvy, they can call 211, and the state has a call center where they will take your information and register you themselves. And then obviously the best way to contact them would be the phone. They'll give you a call back. And what they'll do is they'll call you. If you don't answer, they'll leave a message, and your spot will be secure for 24 hours. You just have to call them back and sign up for it. So you got a 24-hour window to answer your phone or call them back and get yourself on that list.
So at this time, when you're vaccinated, you get what they have, period. You have no choice.
Correct. If there's
Any
a
idea when
vaccine,
there'll be choice for
take it.
vaccination?
I don't, I mean, whatever, a shot in the arm is a shot in the arm when it comes to the vaccine, it shouldn't matter.
Well, it shouldn't, but it appears that the Johnson & Johnson is not as effective. Of course,
Nope, I
That's
gotta, I'm stopping you.
let me continue.
I'm stopping you right there, because it is 100% just as effective as Pfizer and Moderna.
95%?
Is 100% effective for preventing hospitalization. And
Okay.
that is what we care about.
Okay.
Because I'm stopping you because the amount of misinformation and the news focuses on 66%. It is 100% effective at preventing hospitalization from the virus, period. And that's what people need to know.
but the lower percentage is infected. You get infected, it'll be a mild infection.
Correct. And it's the same thing with Pfizer
Right.
and Moderna.
Right. But that information itself may be enough to scare some people away. Plus the fact that it's only one shot right now. I had read that they're looking at 2 shots for the Johnson & Johnson too. So it should be that much more effective than one, but I don't know.
But if you get one shot now and then get a booster in 8 months, at least you get one shot now and you
It's
have.
gonna be, and they were talking to the CEO of Moderna, and they were saying that this is probably what's gonna end up being an annual booster like we get with the flu shot.
So combine it with the flu and,
Combined with the flu.
Probably, that's probably what they'll do, is combine it with the flu.
so quadrivalent will now turn into,
Yeah, like, whatever valent, yeah.
Moving.
Yeah. So
I
I
like
just,
that.
because everybody, and I actually have to say, a lot of my patients are eager to get the Johnson & Johnson because
I know
it's
a lot of
one
people
shot, done, that's it, 2 weeks later, they're immune. But the media was very, very focused on this 66%, and that is not the true data that we care about in the public health world and in the health world. It's vaccines are designed to prevent hospitalization and severe illness. And Johnson & Johnson does it just as well as Moderna and Pfizer. And it's actually probably the best one out of 3 because it's one, done, that's it.
so 2 weeks, you have your.
2 weeks,
full
you're
immunity.
you're
Quick
immune.
process.
Yep. So, the state also came up with a homebound outreach program. So we've done, a good chunk of our homebound already. We know who they are just through, them making contact with us ahead of time, or being in the Meals on Wheels program through the senior center. So we had an idea as to who we could reach out to. We've done a good chunk of our homebound population already, but the state does have a number that people can call. We do have something we're gonna get out in the news and views and online. So there's a number you can call, you can get on the list. You can even reach out to us, we can get you on our list. And we've tackled that, we've done a good job with that. So we're really trying to get those populations that need it the most. Caroline couldn't be here tonight, she gave me her notes, she sent them to you guys as well. Just as a local health department, we've given 1,021 vaccinations. So that's a pretty good chunk that we've done locally with the vaccine that we got. We didn't waste one dose. We actually got extra doses out of multiple vials and did more than we were actually allotted. So if we get more vaccine, we'll continue what we're doing. We are out at this point. We can assist the state with the homebounds. They're trying to really push and encourage that because those are people that really need it. So we're on to that next. And then I guess we can talk about the vaccine that you talked about and the variants. You can give an update on that after me and Steven are done. And we currently just moved into phase 4, the new normal, step 1 on Monday. And Steve has all the details on that to give you guys an update and where we're going with that.
Yeah, so like Brian said, we moved into phase 4, step 1. The big thing that everyone was talking about was indoor-outdoor stadiums, arenas, and ballparks. They're open at 12% capacity. Granted, they submit a safety plan to the Department of Public Health and get that approved. There were also some changes to just overall guidances. I believe the restaurants went back to the 6-foot spacing between tables instead of a percentage-based capacity. They changed the guidance for event venues and public settings. That's 100 people now indoors and 150 outdoors. However, for private residences that have gatherings, it's still 10 people indoors and 25 people outdoors, so that portion hasn't changed. Dance floors are open for weddings and other events. They also announced camps can operate this year. And they also changed the travel advisory, or the travel order to a travel advisory. They still encourage people to quarantine for 10 days on arrival or do the testing out option. But now it's an advisory instead of just an order. So those were just kind of the highlights from the phase 4 change. And then real quick, kind of like Brian said, it's been a lot of the same work for me and Kalechi, who is our part-time inspector. He is actually taking a full-time position somewhere else, so congrats to him. But in the meantime, we have been doing a lot of things. Like Brian said, we've created some PSAs that'll be going out pretty soon. We've been finishing up permitting for food establishments. We've still done some inspections like housing, a couple septic ones. We did have a couple restaurants open additionally. Bird and Wolf over on Osgood Street, they opened their cafe. They're working on getting their restaurant up and running. They're just tweaking a couple things. And then Fabiano's Pizza, Seafood, and Grill, which is across the street from Town Hall in the old House of Pizza. They just opened. They worked pretty hard to get open real quick, and they did a good job of it. So, and then other than that, just a lot of the same fielding questions and complaints, updating businesses and residents on information that comes out, and listening to those great state conference calls.
So does our football stadium count as a stadium, or what does that
I think
count
it's-
as?
I think it's
large capacity.
I
stadium,
think it's like
Gillette.
5,000 people
Yeah,
plus.
it's over 5,000.
But have you gotten that question?
No.
Oh,
No,
I was
it's-
just
I mean-
curious. I would ask if I was using it.
Yep. No. And then outdoor seating also. The
Oh, yeah. Excuse me. Yeah, outdoor seating is coming back around. We've had permits start coming out for restaurants. So they're getting working. If they did it last year, it's kind of just a similar matter of just uploading documents and getting the permits and then adhering to all the COVID guidance. But good catch. That was,
yeah.
yeah.
Well, I
that's
really
something-
hope that some of these restaurants make this permanent.
Yeah.
If there's not very many bright spots over the past year, but one of it was outdoor seating. People realize and understand that people want to sit outside when it's nice out. So hopefully
They do it in
someone's.
Europe all year long, you just get the blankets and it's all good.
But yeah, so hopefully we get a lot more applications for outdoor seating, and we're trying to encourage that too, because it is nice to sit down outside with your family and have something to eat.
Were there a lot of the places that did outdoor seating that we adapted our guidelines, and does that
Yep,
continue?
that's-
So I know
yes.
the police were open to some barriers kind of
Yes,
blocking.
yep.
And
And people are talking about doing nicer barriers or doing, not jersey barriers, but other
Right.
types of barriers that are either planters or things that are a little bit nicer and more aesthetically pleasing to sit and eat
Right.
next to.
Yeah. I think last year was a lot of we'll get what we can because
Right.
everyone's trying to do it, and now people have kind of had time to plan. It's the
Great.
same with tents. If you think about it, there was a huge demand for tents right off the bat, and now people were just trying to plan it, and they're able to get them. So
great.
The travel and the quarantine upon arrival back, that does not now pertain if you're fully vaccinated, correct?
I have that right here. So one of the exceptions is if you're fully vaccinated, which is the two doses of Moderna or Pfizer, or the single dose of Johnson & Johnson, and it's been more than 14 days and you don't have any symptoms. You don't have to do the quarantine or test out.
So people want to get it just to travel.
Yep.
Yeah, thanks, Steve.
Yeah.
And I think that's it. I mean, Caroline gave you her information already, but I think the highlight is that the number of doses that we were actually able to get out, which I think is fantastic. I wish we could do more, and so does she, but we're kind of handcuffed at this point. If anything changes, I will let you know. I know there was some hearings at the state level. Some of my colleagues actually testified before that committee about the role that local public health could and should play. I don't think it fell on deaf ears either, which is really good. But we'll see how that all plays out.
It's interesting. I was at a virtual conference this week for the American College of Healthcare Executives, and Fauci and all sorts of public officials across the country spoke, and all of them really talked about the one thing we should really come away from all this with is public health, and like really how under-supported and underfunded public health departments are, and what a role that they play. And these were big hospital systems that everybody's saying, like, we've learned to come together through this, and that better continue. And we need to continue to do this, and really the merging of public health and health systems is really the success of the future. So it was a nice message to hear
love to
from
hear that.
multiple people all over the country, yeah,
Awesome.
yeah.
I have a couple of questions on the virus, primarily, although not exclusively, to Max and to Patrick and to Brian. But first, I want to just briefly have a word on the retirement of Iveen O'Brien. She's the Director of Elder Services, and in North Andover, we have over 7,000 seniors, and from the perspective of so many of us, she's really done a stellar job. I believe she's been in that position for 18 years. And it's time. You know, she told me recently that, and I know, I mean, times during this pandemic, she and members of her staff have been working literally 7 days a week. She's tired, she's had some physiological problems, and she's resigning. So I wish her nothing but the best going forward, and that's going to leave a huge void in the Department of Elder Services and our senior center. So a few questions that I have concerning the virus. I know that tests have begun on pregnant women and kids under 16. What's the status of these? And again, this is primarily to Max and you, Patrick, and Brian. What's the status of these tests? And any idea when these people will be vaccinated? Michelle, maybe even you have some ideas, because I certainly don't.
Max, you want to do this one?
No, Patrick, you go ahead.
Nope.
Actually, I just
Yeah.
saw there was a article today that they came out. I believe it was actually both Pfizer and Moderna both said it was safe in, which we kind of knew already, safe in pregnant women and women who are breastfeeding. And actually, there was just recently in the last 2 weeks, I forget which one it was, Pfizer or Moderna, that they found antibodies in a newborn. So it was being shown that there is protection in a newborn. Pfizer is now doing studies for children 6 months and up. Actually, 6 months to 12 years. And because they were already in a trial of 12 to 16. So now they're going down to 6 months. So it's more of just, they know it's safe, it's more now just effectiveness. That's what they're looking at. All these vaccines have been deemed safe for kids, but they just more concerned about, because children's immune systems respond differently than us, they want to make sure that they're getting the appropriate immune response. So trials are ongoing right now.
So Brian, here in North Andover, talk about the schools. Which schools are open full?
As of
Virtual?
April 5th, the elementary schools are going back in full. 5 days a week, full classes.
Is that what, K-8?
That is K through 5.
Okay.
And then April 26th, I believe, the middle school goes back. And then April 26th.
Whatever that Wednesday is, it's a Wednesday.
So the 28th. Because April 28th, the middle school goes back, and April 29th, the high school goes back.
Is there
5
any-
days a week.
Is there any talk on the school board to extend the school year to try to make up some
No,
of
they've
this
already
lost
kind
time?
of committed to the last day of school at this point.
I know
I
there's
think
some
because
talk on the level of the state.
Well, the state waived any of the typical guidelines, right, for this year with like days and all,
Yes,
and hours
yep.
and all that stuff.
But what the state did to kind of force schools is took away that exception.
Oh, did they?
Yes. So anything done hybrid or remote after April 5th
Gotcha.
wouldn't count towards class hours. So,
So we better not get any late snow days.
April 5th, I hope not. Yeah. I'd like to actually get an update from you on what you're seeing at the hospitals and patients and things like that.
So actually, at Holy Family, there's just one ICU COVID patient. Lawrence, I'm actually there all next week. Max, I don't know if you were at Lawrence this week and if you know what's going on there at all.
Yeah, I do. So I can tell you both about Lawrence and Lowell. Lowell numbers have jumped up quite significantly. They've gone from 17 cases in the hospital last week to over 30 this week. So it's really gone up quite a bit. Most of them are not ICU-based cases, but a lot of just hospitalized patients needing oxygen and therapeutics.
It was a pretty big jump in 1 week. So it's being mirrored around our numbers too.
I think the other thing that we were talking about earlier was that there was a couple of cases, and you can see it in the news too, of fully vaccinated patients testing positive for COVID. And I just kind of wanted to put it out there that that's going to be common. It can happen. But the most important thing is that almost all of these patients are asymptomatic or have minimal symptoms. So we're more concerned about patients transmitting it to non-vaccinated people. But the most important thing is that vaccinated people are having minimal to no symptoms. That's the most absolute ideal scenario. But there has been no episodes of hospitalized patients who are fully vaccinated and having full-on profound respiratory symptoms from.
So the vaccine's
COVID.
doing its job.
So the vaccine's doing its job.
And people aren't getting sick from it.
Correct.
But it is still transmissible, and same thing with the flu.
Correct. Absolutely.
So it's definitely important to note that, yeah, you'll probably hear more of that in the news. Don't get scared, don't be alarmed.
Yes.
The vaccine's doing its job, the people aren't getting sick, they're just testing positive.
And it's the same, like you said, the same thing with the flu. You can still get the flu with having the flu shot, but a lot of times your symptom burden is much, much lower.
Yeah, good.
There was a heated exchange last week, and I'm going to hit some of the highlights of the exchange between Senator Rand Paul and Anthony Fauci on the coronavirus. And this will be brief, but this is pretty much verbatim here. So Rand Paul says to Fauci, "You're telling everyone to wear a mask, whether they've had an infection or a vaccine. But people who have had the vaccine or have had the infection are not spreading the infection. So isn't your mask, because Fauci wears 2 masks, just theater? Especially since you've already been vaccinated." And I said to myself, well, that's an interesting comment. And again, Rand Paul, he's a U.S. Senator from Kentucky, I believe, a libertarian. And Fauci, he's the director of the National Institute of Allergy and Infectious Disease. So Fauci's comment I found to be a little bit surprising. And he was caught off guard, as he has been in the past, certainly by Rand Paul. And Fauci said that, well, there were a lot of unknowns associated with the coronavirus variants. But the vaccines, we know, are effective against these variants. So an extent, well, we know that Fauci is concerned primarily with physiological problems, not psychological problems, not mental health issues associated with the virus. And we have just tipped the iceberg on that. So the question is to our doctors and Michelle and Brian, and I don't have an answer, which is why I'm asking, who's right? Is Senator Paul right? Or is Dr. Fauci right? And by the way, Senator Paul is also a doctor, too. So they're both doctors. So, Matt, any feel on that? Or comments?
Well, I mean, I think that, as we've said before, the vaccine does not prevent you from getting infected with the virus. It prevents you from dying from the virus and prevents you from being hospitalized with the virus, but it doesn't prevent you from getting infected with the virus. So that's a really important point to make sure that everybody understands, is that until the virus is eradicated, you still have the potential to get it and spread it, even if you're infected. So I think that from my standpoint, I'm going to be wearing a mask for a long time when I'm in places where I can spread it to the people, in those places where I'm indoors and I can't stay apart from people.
But Fauci's answer was primarily a concern that he has with the variants. And I just don't know if there should be such a concern with the variants, knowing full well that all vaccines seem to have worked with them. To me, it's like saying, well, don't drive a car, because if you drive a car, you may be in an accident and die. Okay? But then again, Fauci is interested in physiological issues, not the psychological. And the psychological is a major, major concern right now. So I just struggle by that tit for tat between the two of them. Michelle, Patrick, Brian, any further comment on that?
I don't have any.
Not of that.
I'm not gonna touch that one with a.
No.
I can understand
50-foot
that.
pole, no.
No, but I do think as the Board of Health, we should just also encourage people to get back to preventative care. I mean, I think that's the piece, the huge message that we also need to make sure everyone's getting out, is to really feel safe to go visit their physicians and get the preventative care they need and the screenings that they maybe had skipped. I think that's a huge piece that's what I don't think we've seen yet, is all the people who didn't get their preventative care and their screenings. And that's another, key message that I'm sure you guys are hearing too. Like, people just need to get back to medical care.
Yeah,
Yeah, very true.
absolutely.
And there's so many more people wearing masks now than 3, 6, 9 months ago. I mean, you go most anywhere outside, and with the exception of a few individuals, people are wearing their masks, which is very, very good. So I just hope that they continue to wear their masks for quite some time, whether they have to or not. I know in Texas, they're pretty much open right now, the state, but people are still wearing their masks. So the average person is certainly not stupid. Another article that I read concerning the pandemic. A study suggests that adults under the shelter-in-place order have gained 1/2 pound every 10 days, which equates to 2 pounds a month and 20 pounds a year. And I'm saying to myself, wow, man, I've only gained like 6 pounds. I guess I'm in real good shape. And yet the weather's getting better, with the exception today. And I know I started to run again, the YMCA. I don't want to go back to the YMCA because I can't see working out wearing a mask. I hate wearing a mask, so I'm not going to do that. But because, as so many other Americans, I have been pretty inactive this past year, when I started to walk and jog again, really painful. I'm just not in good shape, so it's going to take a while to get back that stamina. Hopefully, I'll be back sometime this summer. But that number is really frightening, the weight gain, especially considering that 42% are obese. 42% of people are obese, and 32% are overweight. I mean, I just went within the recommended BMI to be an overweight because of the pandemic. So
I think Michelle's right. We got to get back to some of the stuff we were doing prior to the pandemic, other public health, and getting some education initiatives going, public health programming, information. out there into the public on exercise, eating healthy, doctor's visits, preventative care. Prevention is one of our main focuses. Before we go to the last item on the agenda, next month, we have a conflict for the meeting. It's April vacation week. So I won't be here and Caroline won't be here,
I won't be here either.
and you won't be here either.
No.
We'll talk further about it.
So we will have to move April's meeting.
Yeah.
So we will do that over the next couple of weeks. And I think there's one more item on the agenda, if anybody wants to.
I'd like to make a motion to adjourn.
Second.
All right. All those in favor?
All those in favor say aye.
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 All right.
Meeting's adjourned.